So face is the chief seat of beauty, and maxillofacial surgeons just work on the face. So who are these maxillofacial surgeons? In this short video, I'm going to try and answer some of the questions a lot of patients, a lot of internees, fellows and doctors keep asking me. They want to know what is maxillofacial surgery, what is the scope of maxillofacial surgery, how is the learning curve, what are the legalities involved, and also if you can make lots of money. Now, I think the logic with doing something well, for that matter, in anything in this world is about passion and hard work. So I keep telling them in one line that if you have the passion, if you have the dedication, then the hard work, no matter how many hours you put in, it's only going to be pleasurable. It's not going to be drudgery. It's not going to be boring. And so you put in lots of effort and work while you enjoy it, and at the end of it all, you also become a good surgeon. So that really is the mantra that I would want to say in one liner. But to get into the details of what is maxillofacial surgery and everything, I'm going to just tell you an overview about what it is. So maxillofacial can be split into two. Maxilla refers to the upper jaw, and facial means the face refers from the hairline to the Adam's apple and between the ears, including the ears, right? So maxillofacial surgeon is a surgeon who is region specific. So he works only in this area. Now, what's the difference between a plastic surgeon? A plastic surgeon is one who can work on the whole body, but generally works on something called as the skin and muscles and soft tissue, and hence it's referred to as plastic, moldable. While maxillofacial surgeons typically also work on the bones. So on the face, you have bones, you have cartilage, and obviously you have skin as well. Now, the range or the scope of maxillofacial specialty varies because it's a new specialty. The legalities are different in different countries. The training pathways are different in Western Europe, for example, in the US, different in China, Brazil, and again different in India and many other countries. So all of these kept in mind, you have to realize that's a very, very niche specialty. So whenever you're entering into something niche, there's always a lot of hard work. There's always a lot of trampling or moving into other people's specialties. There's a lot of overlap, in short. Now, maxillofacial, for example, has a lot of overlap with plastic surgery, has a lot of overlap with ENT surgery, and also has a lot of overlap with various other masters in dental surgeries. Now, the training aspect in India is very varied. And I think the most important factor for a surgeon to be good is his training. It depends on how many hours, how many weeks, how many months, and how many years of training you're willing to put in order to master something. Surgery in any specialty in this day and time, in this era, in this modern world, is an evolving process. So you've got to be constantly learning. I, for one, always think that every program I attend to, every event I go and give a lecture, there's more to learn, in fact, than more to teach. So it's going to be a combination of learning and teaching, and that's something you have to remember when you embark on this field, and that's something you'll have to do all your life. The moment you stop doing that, you would tend to become a dinosaur. You would tend to become outdated. And then there would be people who are out there doing the latest things in the most better possible way so that they're able to achieve better results. Just to give you one example from my own training. I finished my training here, did my fellowship in cleft and craniofacial based in India and Switzerland, and then I've done training in multiple Indian centers and in many different countries in different parts of the world. But yet, I didn't do my training on hair transplantation at that point in time. It wasn't there at all. Many years later, more than a decade, I did that training as well, and then we've slowly incorporated that into our specialty, into the kind of work we're doing here. Yes, do we need other specialists to help us? Absolutely. So today is also an era of teamwork. So maxillofacial surgeons would need to know how to work with a plastic surgeon, how to work with an ENT surgeon, how to work with a dermatologist, how to work with a speech pathologist, a pediatric anesthesiologist. The list goes on. The number of people you can work with, the number of dentists, the number of doctors, the number of surgeons you're able to collaborate and work with increases improves you, increases the scope of work you can do, increases the amount of people you can do your work for. So I think maxillofacial surgery, in short, what I'm trying to say is a growing specialty. Our association, the AOMSI in India, is doing a fabulous job. They're not only training people literally, they're taking all efforts to do all kinds of training on the social media, in the web platform, and also by doing various fellowship programs. So if you are a young trainee, you want to know if you can make lots of money, I think the answer is a big yes. Because if you are willing, if you are having the passion and the desire to do good work, and then obviously you're going to stand in front of kings, because people who do good dedicated work always have need in this world. There's never a shortcoming of such people. There's never a dearth for people who are good in their work. So when youngsters ask me this, and I also like to tell them that look, it's also hard work, and so you being passionately involved in this specialty will take a lot of effort or burden when you're doing the hard work. The hard work should be a joy, it should be a challenge, it should be a milestone that you would want to keep crossing. So I think I've answered a few questions with regards to maxillofacial surgery and its scope in India and abroad. Every country has different legalities and different permissions and different privileges. So you must realize that before you embark on this. But really, if you are passionate, and I think the sky is the limit. People with all specialities, even though might have some issues with you in your earlier years or months, will eventually join you, will eventually form teams with you, will eventually support you, will eventually even refer lots of cases. You would be surprised to know how many of my patients are referred by plastic surgeons, ENT surgeons, and other doctors in Nagarcoil, in South India, even in the Middle East. It's more number of doctors every week, every month. And this is because they also have to be convinced that you can do good quality work consistently. So that's up to us to prove our ability. Having said this, Indian maxillofacial surgeons definitely have carved a niche in this world, and I think they're one of the very best in this world, if not the best. So I really encourage all youngsters who want to embark on this journey of maxillofacial surgery, which can also then lead to craniofacial surgery, which can lead to so many different avenues. So we treat from simple dental surgeries that involve the teeth, from wisdom teeth. We can then go on to do even cleft and craniofacial surgery, various distractions, jaw surgeries, aesthetic surgeries, post-traumatic surgeries, or fixing people who have accidents. You can also learn and do cancer surgeries. You could take fellowships in microvascular surgeries. So I mentioned a whole realm now, a whole new world, a whole world of opportunities and openings for maxillofacial surgeons. And I think this would encourage many youngsters who are passionate about surgery to take up this specialty and not look at whether they're going to make it big or no. Because as I said earlier, if you have the passion and if you're ready to put in hard work, and then there's no stopping you. Sky's the limit. Thank you.